Yeah, I'm a big fan of. I really like this idea of voucher programs and choice in public services
Yes.
like schools, maybe even police departments. So we have public school, but everybody pays taxes. The rich will pay obviously more simply by virtue of having more money. So like 10% from someone making 10 grand is only 1,000, but 10% from someone making 100 is 10,000. So that means the rich people pay more. But everybody gets back one voucher. Then they choose the school they want to go to, and they use the voucher as a equalized currency for specific services.
But they all get the same voucher.
Exactly.
Okay.
Which means people from poor neighborhoods will all of a sudden have access to the better schools.
Right.
And create an incentive for schools to improve and do better.
Oh.
But then wouldn't that create a system where schools in the better neighborhoods would have to have admission policies? And then they would get to reject certain students, and then you're going to get a lot of racist claims.
Maybe.
Yeah,
Maybe.
big time.
I don't think, it's I'm fairly lukewarm on a lot of the ideas because it might be really utopian to be able to be like school choice is the solution.
Right.
And it's like you got to do a lot of testing. Maybe there's some pilot programs we can do and try and figure these things out. Maybe there's good evidence to suggest we should at least, go for it in certain areas, see what happens. I think everybody needs to realize no matter what action we take, there will be fallout. We can change. Bernie Sanders, universal health care. I love the idea. I really do. I just don't know how you do it because 20% of our economy is based on the medical infrastructure. That includes insurance companies, administrative, that would be wiped out if we switched the system. Plus, he's in favor of banning private insurance, which is just not a good idea at all. No one does that. Like all the universal health care around the world, they don't do this. I don't know why there are Americans who want to do that. That makes no sense. So it sounds great, this idea that we can give this service to someone, but there's so much in between that, like, if we just right now snapped our fingers and said, okay, it's all universal health care, then I think there's like 4 million jobs that get wiped out overnight. And even Bernie has talked about this. So how do you do it? I'd love to. Don't know if you can.
But I think those jobs would be recreated. And I think it's not like coal miners to learn to code. Am I allowed to even,
Yeah.
So, yeah. So I think it's a different system from, I think that the jobs are equivalent in a lot of ways or similar so that people would then move from the private insurance companies and then they would switch over to working those many jobs that would be created by that system, and it'd be a similar job.
So the issue I have there is just, telling Clarence, who's been working this job for, private tech health for 20 years, you're fired. Don't worry. At some point, a new job will emerge, and then you'll figure it out.
Well,
In the
that's why I
meantime,
think
good luck.
Bernie said it would be 2 years of pay for them because they believe it would take 2 years to get them retrained and moved into those new jobs.
I think that ignores the human experience. I think people like their jobs. Not everybody. Some
But
people
they would have the same job. It would
Especially
just
not
be
in insurance.
No, I mean, like, if
Most
it's a
people
2-year
don't like
transition
insurance.
period where, like, all of a sudden their job is gone.
Well, they would go to school. Or they would be training with the new company, a lot of it, right?
I think, Joe Biden said when we shut down Keystone, don't worry, there'll be new green jobs.
Right, yeah.
And that didn't happen.
That's different, though, because those jobs are very different.
So I think, to an extent, yeah, absolutely. I think in the private healthcare industry, there's an overlap, but I still think they're going to be different jobs. You're not going to do the same kind of paperwork for the government you would do for a private corporation. And then we're also telling, 4 million people or whatever that, sorry, your jobs are gone.
You could tell them like in advance, like, hey, Clarence, if you're working private insurance, your job is going to be gone within the next 10 years. So it's up to you. I can't make you drink, but I'm leading you to the water.
I think ultimately, though, we should go back and say, I think Bernie's plan of abolishing private healthcare is nuts. We should absolutely have, if we do a universal system, private as well. Mm-hmm. And that's what every single other country has. So the way I envision it is there's like a base level care. You get the flu, you break a bone, certain ailments that doctors can save you, ready and available. And then you need private supplemental for the much more difficult to treat ailments that are too expensive and might overwhelm
Like
the
chronic
system.
health care, that'd be cool. Private health care for chronic health care.
Things
stuff,
like that.
But acute could be all like government controlled.
Exactly. So like if you break your arm, you go to the doctor, they patch you up, have a nice day. I know a lot of them on the left don't like this idea because it means if you get a extremely rare type of cancer,
Yeah, like what if or just cancer?
private health insurance.
What about doing it the way England does it?
How do they handle it?
So everybody gets everybody gets public insurance, like a Medicare for all system. But then if you want extra luxuries, like you want a private room at the hospital, you don't want to share,
Then
right? You want 4 days of maternity rather than 2, getting kicked out of the hospital after having a baby,
Then you
things
can
like
pay for
that.
it.
And I think they even have a system where there are some fully private hospitals and doctors.
Then maybe the private hospitals is the right way to go. It still creates a challenge though, because you'll end up with still extreme envy and demands.
Don't you think it would be similar to just school? So right now you've got public school. All of us can put our kids into public school, but we also have the option to enrolling them in a fully private school that we have to pay for.
Because the cost of treating chronic health care can get, I think a lot of it's diet related. We have 60% obesity in the United States, I think, and that's by people by their choice to continue to eat crap. So I don't want to fund or saddle people with debt of lazy, ignorant people that want to live in ignorance and poison themselves with food.
I think it's a little harsh.
Food addiction.
I think it's a little harsh.
Food addiction is one of the most dangerous addictions on the planet.
I think you had the sugar industry lie and manipulated people who didn't understand
and are still doing it.
And so to call them lazy, I think there's a lot of
people have been used. They've been.
It's like a meth addiction.
It is.
Remember we had Ethan Suplee on the show,
yeah.
And he said he was trying everything, and he was really just like his entire life trying to figure out how to get it right.
But I don't want to spend money treating the symptoms of the problem if we're not going to treat the problem. We have to fix the problem. Now that I'm into.
If you had a doctor, but if we had a universal healthcare system and everybody had a doctor, and this doctor is going to service however many people that they've got, and that doctor is now encouraged because of that system to tell everybody to start eating right. And that doctor says, take vitamin D and eat right.
What if every morning at 8 a.m., every American was forced to wake up and turn their TV on where a giant face told them to do squats now? One,
no, that sounds too much like 1984.
Yeah, exactly like
I like
that.
the way the fire department's built. They don't get paid per fire. Like, they don't have an incentive to go put out fires, or I would see firemen starting their own fires to get paid more. The doctors get paid a lot of money for selling things and giving the antibiotics companies want to force hey, we'll pay you to sell our products.
Certain drugs.
If we could remove that stuff from the industry, and they were actually, we don't want patients. We want you to be healthy. If that was their ethos, then I could see a chronic healthcare system.
Right, but the only way that could be incentivized is through the government.
Voucher system.
Oh, I don't know about that. You can I think we can enlighten people as private citizens too.
But they're not going to make money unless the government gets involved and says, we incentivize you to have a healthy population of people. And the healthier they are, we give you bonuses.
What if there was some similar type of voucher system? I don't know how that would work with hospitals, but the general idea is everybody gets equal access to certain services, but there's still a kind of market exchange.
So
private hospitals.
This might be interesting to you. Oh, sorry, let me push the right button here. But I actually worked for a hospital. Not the right button. Oh my gosh, there we go. Okay,
that's not the right button either.
The buttons
I'm
in your
gonna
mind.
push all the buttons. There we go. I've never done that before. I was gonna say, I used to work at a hospital, literally in a hospital, and one of the things they did was they would incentivize you to eat right and to weigh the right amount and to have the right cholesterol level. And they would give you a reduction in your health insurance costs. They covered everything. But if you were high, they would help you figure out how to fix it. They would help you eat right, and they would help you figure out if you actually needed medicine. And that was very useful for the people who worked there. It's a big company.
I think we should start our own country. What do you guys think? I think we're solving all the world's problems here.
Do you have a good one we can tweak?
Do you like Ron Paul?
I do like Ron Paul.
Ron Paul has this quote where he said something like, there's nothing stopping anyone from starting a socialist community or city or town. It's just that socialists want to take from you. And to step back a little bit, I saw that and I'm like, I understand he's going to talk about the socialists and say they're trying to take your stuff. Okay, fine. But there's a good point in that we could literally just buy, 100 acres and then be like, okay, communism, here we go.
We could build a floating island.
So it is an interesting point from Ron Paul that they do just want to keep saying, we get your stuff. But how about you go and make your own commune? And there are people who did. It's about 100 people. It is a farm community, and you apply to join. And if they approve you, you work and you bask in all of the glory and everyone's friends, and then people rotate in and out, and it works. They started their own system, which is it's communism, and it works because it's a small group of people who have built their own, and
it's democratic,
right? And they're within the confines of a well-protected country. So I often say that I'm not personally a right libertarian, but I would prefer if we had to create a government. Out of anything, it would be more right libertarian because it means I can start my left libertarian society on my own and be left alone because no one's going to mess with me.
Well, because it would be democratic.
Yeah.
Right. Whereas you would also be able to start a community that was purely something opposite of that.
I saw these Bitcoin millionaires or billionaires maybe building new cities. Have you seen these
No,
articles?
what?
Super high tech.
Yeah, the high tech was. There's one that's coming right in Nevada.
Okay.
It's already the plans. I'm pretty sure it's in Nevada. I'm pretty sure.
It's going to be that could be a possibility to like integrate machine learning and artificial intelligence and kind of fix a lot of the
These
shipping.
Bitcoin millionaires have done really wacky stuff. You see that there was one Bitcoin millionaire who tried manipulating the Magic the Gathering market.
No.
So his idea was that if he offered enough money, he could get someone to make a deck. It's a game for those that aren't familiar. He could get a professional player to play in a certain way that was completely unheard of because he was like, I'll just pay you to do it. And then he thought that by having that professional play this in this tournament, using a weird system, it would encourage younger, newer players to do the same thing, which would totally just throw the game into whack. And he dumped like 40 grand into it just because he could.
Wow.
Yeah, these
The
people,
human mind.
people who got rich overnight and are just like, I don't know, whatever. Here's 40 grand. I'm a
we
Bitcoin
need to
millionaire.
get those people together and give them some purpose because there's a lot of Bitcoin money out there right now.
They need Elon Musk to like sit down and give him a pep talk. A lot of them are smart people who got rich. Some of these, I've met a couple of Bitcoin millionaires, and some of them are dumb as a box of rocks. So there was like a really funny meme in the early days of Bitcoin, which Bitcoin's at like $58,000 right now, by the way. And it was like when Bitcoin was very new and it was going up in value, but only worth a little bit. There's a meme where someone's like, okay, this Bitcoin thing's interesting. What can I do with it? And then, I don't know, it was someone saying like, I bought a couple of Bitcoin because I was interested. It went up and now I have $20. And then there was this really crazy punk rock anarchist looking guy who said that he was like, I'm a billionaire because I knew I could buy drugs on the internet with it. So I bought a bunch. And it was pointing out how like early on, a lot of people who were buying Bitcoin were not like investors or like people running businesses. It was the
Right.
people who were like, ooh, I could use this.
Silk Road dark web stuff.
Exactly.
Yeah.
And so I know some people who got rich and they're not smart. They don't get it. All they knew was like the government. It's not government, but it's money. And they were like, sign me up.
They
and
didn't
they
even
have
tax
no
it.
idea how it works.
I think it didn't get taxed until 2019 is the
Yep.
first year they started taxing it. That is crazy. People made billions of untaxed.
billions.
Individuals, billions. I earlier you said about the healthcare system. I don't like that it to think of it as a for-profit system. I would like a government system that's not for profit.
Right,
So kind of like
right.
the fire department. It's not a for-profit
Right.
system as far as I know. It's
But the
just-
question is, how do you get? You'd have to get the current incentives out, like you mentioned, right? And then the doctors are going to be like, yeah, but now I've got all this student loan debt, and I've got to be able
That's
to pay
another
this
big
back.
problem. That's another piece of the puzzle. Liddy and I talked about this a while ago when we had a fire out back in Philly.
Yeah.
It's the debt. So I don't think doctors need to go to school for 12 years to be able to show that they know how to do the job. If you can learn the information and take the test and show I can do this, then you can do it. So the system that is destroying people with debt, unnecessary, I think, at this point. The knowledge is on YouTube for the most part. The knowledge is on the internet and can be learned very quickly.
Or at least just a medical school that's inexpensive. We don't even have those. We have very few medical schools. We need more medical schools, and the ones that we have are expensive.
So we have to ask ourselves why school costs so much. I'm going to push the right button this time. And it is because the government subsidizes it. I firmly believe that if the government didn't give so much money to schools, because you're right, they will charge what the market will bear. And if the market bears this kind of government subsidy,
I don't know. I mean, schools are underfunded. Not in many areas, like the school that I went to in Chicago. It's like
No, not but yeah, but college.
Oh, colleges.
Colleges for profit.
right, definitely.
Yeah.
Yeah.
It's a racket.
I'd
Yeah,
be into
it's
it.
total racket.
If you could do like a 2-year medical program and then take a bunch of tests and show like in person, like, yes, I can do the surgery on the thing.
Well,
I know all
let's-
the parts. Make them a
let's
doctor.